morning, ladies and gentlemen. I would like to welcome you to this live virtual meeting where we're going to be looking at the projection analysis of Bulawayo in terms of where we are coming from, where we are, and where we are heading in the fight against COVID-19. I am your host, Vaccination. So on today's discussion, we're going to be focusing more on the major milestones that we have achieved in the fight against COVID-19, looking at how far off we are on the mark of the projection analysis, and most importantly, look at what the future looks like. So before we get into the discussion, remember to follow the conversation on Facebook Live, either on site or on I'm for Bulawayo Fighting COVID-19 Facebook pages. To follow on site, do log on to www.facebook.com/site, or on I'm for Bulawayo, log on to www.facebook.com/I am for the numeric number /I am for Bulawayo.com. Okay, fine. With that being said, today we have a really interesting and respectful panel that's going to engage us on today's topic, where we're going to be looking at where we are with regards to COVID-19. So to our panel, we have Honorable Judith Ncube, who is the Minister of State for Bulawayo Metropolitan Province, and she's here to engage us on today's discussion. Mama, welcome.
Thank you.
We also have Dr. Mark Dixon, who is a consultant, a senior lecturer at the National University of Science and Technology for the Faculty of Medicine, and a training director at East Central and Southern Africa College of Physicians. Dr. Mark Dixon, welcome.
Good morning. Thank you for having me.
It's a pleasure to have you. Last but not least, we have Ms. Jana Ncube, who is one of our trustees here at I'm for Bulawayo Fighting COVID-19 Trust, who is also a policy advisor, a civic leader, and a human rights advocate. Ms. Jana Ncube, welcome.
Thank you, Batabile. Good morning, Zimbabwe.
Great. So this is really going to be a conversation. And to kickstart this dialogue, I would like to just probably direct this to Dr. Mark Dixon. You would agree with me, Dr. Mark Dixon, that at the onset of the fight against COVID-19, there was a projection analysis which was done, looking at the likelihood of COVID-19 infection in the city. So with that as our background, what were the highlights of the projection analysis, Doctor?
It's a year ago now. It's amazing how fast it's gone, but last March, when it became obvious that this pandemic was sweeping through the world and that many countries were being overwhelmed with infections, there was a planning exercise within Zimbabwe generally, but also within individual cities to prepare for what might happen. In Bulawayo, we looked at what might happen in a city of plus or minus 1 million people. And as is common with these things, we had 3 scenarios: a sort of best case scenario when we had a very mild epidemic, a worst case scenario when we had a very bad epidemic, and something in between, a middle case. And we sort of did what people often do, and that is to hope for the best, but to prepare for the worst. The worst case scenario projection at that time was based on what was happening in Italy and in New York, if you can remember back when the hospitals were swamped and they had death rates they couldn't cope with. Mm-hmm. And we applied those sort of figures to our population and calculated that if that happened in Bulawayo, within 6 weeks, we'd have nearly 3,000 infections, and that we'd have almost 200 people requiring ICU beds and possibly ventilators. And clearly that would have been an issue for the city, and we started to try and plan for that. Our best case scenario projected only about 40 to 50 cases and only 2 or 3 people in an ICU situation. And the middle case scenario was something in between. The best case scenario was based on what had happened in South Korea, and the middle case on what had happened in Germany. what happened after that was that thankfully we had a sort of best case scenario. And it's interesting to look back and say, why did that happen in Bulawayo and Zimbabwe in general? And I think it was down to good planning and the right initial reaction from the government and from society in adopting the advice. We had quite a strict lockdown. We closed the borders and we started strictly screening and isolating people who were moving in and out. And we had a very effective test and trace system for the few cases that cropped up. And the end result of that was that we just didn't really have a significant first wave. I can talk about what's happened subsequently, but that's what happened back then.
Okay, thank you for that feedback. And I'm actually happy that we actually experienced a best case scenario. So you have highlighted some of the measures that were taken in place to try and achieve that kind of scenario. But I would also like to find out from the Honorable Minister, where Bulawayo in terms of COVID infections, where we are really, and also what we are doing to continue to contain the impact of the city.
Thank you, Batabile. Good morning, Zimbabwe. As of yesterday, Tuesday, the 23rd of February, 2021, the city recorded one new case over the 24-hour period, bringing the cumulative total to 5,240 since the pandemic began. There was no death, bringing the total number of fatalities to 200. Over the past 2 to 3 weeks, we have been averaging about 2 to 3 fatalities per week, from as high as 10 or more fatalities a day a few weeks back. On the positive side, there were 8 recoveries for a cumulative total of 4,907. One of the key statistics that we track is the number of active cases in the province, which as of yesterday had fallen to 133. This is significant because in mid-January, we had over 700 active cases at one time. And active cases are the ones that transmit this pandemic. We can say that the lockdown improved by government is in response to the spike at the end of 2020 has worked as borne out by the statistics that I have briefly outlined. But the last thing we want is complacent. We must all continue to do the basics faithfully. Mask up, sanitize, and maintain social distance.
Okay, thank you so much, Honorable Minister. So from your feedback, I'm picking up that it is important that we have a collaborative approach in the fight against COVID-19 to try and keep the figures down. And I also appreciate that you're also highlighting the spike that was recorded soon after the festive season. So with that in mind, I'd just like to probably have a chit chat with Miss Jana Ngube to find out what I Am for Bulawayo Fighting COVID-19 did and continues to do in fighting COVID-19. What were the efforts that were put in place?
Thank you, Batabile. Well, I Am for Bulawayo is a platform that brings together business, private sector, NGOs, doctors, pharmacists, nurses, citizens that decided to come together and work together to fight COVID-19. At the onset, what we did was really bring together all the stakeholders to brainstorm to say, well, this is happening around the world. and we recognize that we are not going to be exempt from it, how can we rise up and do something in support of what government was doing, and the efforts that government was making towards COVID-19.
Okay.
And I really am pleased to say that through those platforms and conversations, I think Mark will remember the many daily almost Zoom meetings that we would have to brainstorm, to understand even what was going on. We were lucky, of course, to have him put together these projections that were very helpful for us to really understand how this virus would likely affect us as a city, and what it is that we then needed to do to protect ourselves, and but to also equip ourselves to ably fight the virus. What we did was we engaged the different health facilities in the city to understand their state of preparedness. We were able to assess and identify that a lot needed to be done. The infrastructure and a lot of the facilities really needed to be renovated and be made up to date. And I think we were also trying to understand the nature of the virus and how, you know, it infects people. So the type of equipment that the hospitals had, was it actually adequate for what was needed to fight the virus? I think when we did those assessments, and when we understood also the responses in other parts of the world, we then started prioritizing supporting the facilities. And through those conversations and through the really well able support and facilitation of Honorable Judith Nube, who is the chairperson of the COVID task force for Bulawayo, we were able to advocate for Egusileni being the facility that really needed to be resuscitated primarily for COVID-19. And also we have Thorn Group in Bulawayo, which is our infectious diseases hospital. I think it was one of those that was identified at that time. And now also, of course, we also have the UBH as a COVID facility, but all hospitals needed to be engaged, because at the end of the day, when people are sick, they know that by and they go and look for help. So it's not like all other facilities would be exempt from this. So our efforts really were around then mobilizing resources, mobilizing equipment, mobilizing what the doctors were telling us was needed. We all discovered a phenomenon which I think as ordinary citizens was, we didn't know to try PPE, personal protective equipment. It used to be something confined to health practitioners. We now needed to understand what was that. So we mobilized in business, NGOs, citizens rose. I can say I'm really proud of that. And donations of equipment were made, donations of PPE were made, donations of money were made. And as I am for Bulawayo, I think where we were also quite helpful was helping those who wanted to make donations know what the facilities needed. Because I think initially we saw a flood of PPE, masks, people were sending masks, people were sending gloves, but we were being also advised by health facilities and health experts what else was needed. So we're actually able to go back to private sector and say, no, we need oxygen, no, we need this, no, we need this. And so that is a role that we played as I am for Bulawayo. I think I can also highlight the fact that during the first lockdown, which was something really new, I think for all of us, particularly in this country, we also were able to mobilize food that was distributed to different communities as well across the city. So those were some of the initial things that I think we did. We're helping really provide some thought leadership. We're helping advocate for what the city needed to do and helping the facilities get ready to be able to take in likely COVID patients based on the projections that have been done for us.
Okay, thank you so much, Ms. Jana Ncube. That is a lot of amazing work that you have done as I'm for Bulawayo Fighting COVID-19 Trust. And, you know, I would like to just follow up on your response to find out the lessons that have been learned in the fight against COVID-19, because you've done this since March 2020, and now we are in February, and the predictions that there might be a third wave of COVID-19. What lessons have been learned? And probably this could guide us when projecting what the future looks like.
I will answer, but I would also love to hear what Honorable Judith has to say from her side, and what also Dr. Dixon has to say from his side, because I think there are lots of lessons that have been learned. But I think for me, speaking from I am for Bulawayo, I would say that one of the things that is so important to emphasize that I think we can all agree was the fact that everyone has a role and a responsibility. We recognize that we can't say government, this government, that yes, government has a role and a responsibility to take care and protect its citizenry, and it's rolled out effort to do so. But we recognize we can't all sit and fold our hands and say we are waiting for government. We also, as citizens, have a role and a responsibility. So there was, of course, that agency for us to really say, as citizens, let's stand up, let's work together, and let's do something, not only for yourself, because for me, I kept on saying, if my father-in-law gets COVID-19, he's in his late 60s, where is it gonna go? What's gonna happen to him? If my mother was also in her late 60s, gets COVID, what's gonna happen to her? So that really urged me as an individual. And of course, some of our roles and responsibilities are also to do with our self-conduct, and making sure I'm wearing my mask, making sure I'm washing my hands, making sure I'm social distancing, and so forth and so on. But also that role also is really about my contribution. What am I as an individual who lives here? What is my contribution? I was so touched in the early days of Bulawayo. My mother called me and said, send to me $300. Please, can you put it for me at I am for Bulawayo as well? I really felt proud that everyone, even my mother, says, she sent her $300 to say, let's contribute and put our money together. I mean, I remember our vice chair, Dr. Lindiwe Spanda, who started Utumamina, with the hashtag Tumamina, to say, me as a citizen, send me to go and contribute something. So that's lesson one. I would say lesson two is surely working together, we achieve much. And I think I am for Bulawayo, that's one powerful lesson. As I said earlier on, we are business, we are NGOs, we are diasporans, we are doctors, pharmacists, we are individuals who came together to work together and felt we have something to contribute to this beautiful city. Many of us either were born here or lived here or work here or are resident here. Somehow, as Zimbabweans, this is a part of our country. And I can also really attest this, that we worked together so well under the leadership of Honorable Judith Ncube, because as the chair of the COVID task force, she was very open, very engaging. I remember my first meeting, Mark, it was that meeting where we went to sit with them, where we were saying, as I am for Bulawayo, this is what we think. She was very receptive. So there was I think Bulawayo had this advantage for me, that we work together, city council, government, NGOs, private business actors, we came together and worked together because there was this sense that we have to work together. So working together, we definitely achieve much. And then I would say the third thing that I feel is a lesson learned is, maybe it's good we didn't know that then. We could panic from what we were seeing out there, but the work is a lot. We still haven't achieved all the goals that we had set for ourselves. And so the work there's still a lot for us to do. And so the rolling up our sleeves and our efforts and contributions are still needed.
Okay, thank you so much, Ms. Jana. Collaboration is surely key, and you've shown that through your works at I'm for Bulawayo Fighting COVID-19 Trust. Now I'd like to find out from the Dr. Mark Dixon, what are some of the lessons that have been learned in the fight against the pandemic?
Yeah, I think there's two main lessons for me. The first lesson is that you can stop the spread of this virus pretty effectively if you stop people having contact with one another. So a strict lockdown works very well in containing the virus. But the second lesson is that strict lockdowns have many other effects, most of which are harmful. And I think we're all now very aware of what happens when we have strict lockdowns. People can't work, their income goes down, they have trouble sourcing or being able to buy food. Other health services suffer as hospitals concentrate on COVID and stop offering outpatient services and things. And children and schools is an obvious big problem. So we have these two lessons that we've learned. And of course, the question is going forward, how do we balance the two? And I think the key bit of it is that we know this virus spreads through contact. And if we stop people having contact with each other, we stop its spread. But for us to live normally, we have to have some sort of interaction at work, socially, in schools, and so on. So the challenge is to allow life to go back to normal whilst we minimize the sort of contact that spreads the virus. And we're a little bit wiser about that. We know that it can spread through touch. We know that it can spread through the air. And we know that if we spread it in the air, it can settle on surfaces and somebody can come along a little later and touch that surface and be infected. So that masks are very important to stop infected people putting the virus out into the environment, and masks are very helpful in stopping individuals from breathing in the virus. Sanitizing hands as frequently as possible, either by washing them or by using sanitizer, will mean that if we've got the virus on our hands, we're less likely to get it into our nose and mouth and develop the disease. So that's what I'd like to see happening going forward, is that we gradually open up, get back to a normal way of life, and find ways to encourage people to do that in a responsible way, both for themselves and for the people around them, by appropriate use of masks and sensible behavior.
That is a brilliant lesson learned right there, Dr. Mark Dixon, because you are speaking to the importance of adhering to all recommended precautionary guidelines against COVID-19. So I think really, once we do that as a community, as a society, we stand a better chance in conquering the pandemic. And for you, Honorable Minister, what are some of the great takeaways and lessons learned from this pandemic?
Well, there is a lot. It has already been highlighted by the previous speakers, Baba Dixon and Mama Ujana. To be honest with you, Zimbabweans, Bulawayo Mhle, I want to start by saying thank you very much for the cooperation. We really appreciate, though we had some people who could not want to cooperate, yet we were trying as people of Bulawayo, as people of Zimbabwe, to say, okay, let's adhere to the laid down rules and regulations in order to avert this deadly pandemic. Others, you'll find others organizing some parties. We saw a lot of shabins resurfacing. Hence, who would want to say to our Bulawayo Mhle, let's cooperate, let's work together, let's work collectively. If we think together, throw all the ideas together, come up with some plans in order to assist each other, let's do so. Let's avoid some of these things that some of us were doing during this pandemic, during the lockdown. I learned a lot, Batabile. I learned a lot. Each time we had a meeting, we would brainstorm as a team, as a task force, because the task force was composed of, a lot of stakeholders. After brainstorming, you'll find that you would come up with a recommendation that we would all agree to say, let's quickly do this at Thorn Grove. Let's do that at Usileni. Let's do that at UPH. Let's do that at Mpilo. And so on and so on. That assisted In Bulawayo. And if you look also into the business community, the role that they played during the lockdown, I would make an appeal, especially, just to cater for the vulnerable people, for the less privileged persons within our society. The business people would come in to assist with meal, assist with cooking oil, sugar beans. I'm so grateful that in Bulawayo, we are prepared to work together as a community. We are prepared to assist our healthy workers, our frontline workers. I'm so grateful that our frontline workers, they knew very well that the pandemic that they were dealing with is very deadly, but they dedicated themselves. I want to say, I salute them. I'm so happy for them that finally the vaccines have been delivered to our province. And on Monday, we saw the first batch being sent to UPH, the first group being vaccinated. And today we are talking of more than 4,000 something people who have been vaccinated. As a first target group, I'm so happy that the government took a very good decision to target our frontline workers. I'm so happy. Thank you so much.
Thank you so much, Mama. And you're very passionate in your response, and that really is encouraging to young people and the youth to see that it is important for all of us to be active in the fight against COVID-19 and to also cooperate, like you rightfully put it across. So to all our followers on Facebook, do participate. Don't wait for the last minute to share those burning questions and contributions. I'm going to be directing them to the panelists as the discussion develops. The platforms is on Facebook, on site, or on the I'm for Bulawayo Fighting COVID-19 Facebook page. So to bring the discussion to the present, you rightfully mentioned, Honorable Minister, that vaccination is in course. And I'm happy we have one of our guest speakers here present who was recently vaccinated. Just yesterday, he was vaccinated. So I just want to probably pose this question to Dr. Dixon. The vaccine is here. It was launched in the country. It was launched in Bulawayo on Monday, the 22nd of February, 2021. In your perspective, how do you see this affecting the city?
So with all infectious diseases, and it's true of COVID-19, the way out of the epidemic and the problem is when society becomes immune to the infectious disease. That's why you'll hear talk of this thing about herd immunity. It means when enough of us in Bulawayo are immune to COVID, it will fade away and disappear. And we can become immune either by having the illness, and afterwards our immune system retains a memory for this virus, and if it crops up again, it gets rid of it quickly. Or we can have a vaccination when the immune system recognizes the vaccine and is able to develop a memory so that if we encounter the virus, it can get rid of it quickly and we don't get sick. So these two ways of getting immunity, either by having COVID or by having the vaccine. And for 80 or 90% of us to have that is the way to get out of the epidemic. The problem is that although we've seen significant amounts of COVID in Bulawayo, it's probably still less than 10% of us who've actually been exposed to it. So we're nowhere near close to the 90% we need. And that's why vaccination is so important. If we can vaccinate significant numbers of people, we can develop this herd immunity within the society and get back, and COVID can disappear. Now, there is one note of caution, and people will probably be asking questions, and that is, if I have COVID, do I remain immune for the rest of my life? And are these vaccines completely effective? And in particular, are they effective against the new variants that are cropping up? And the answer is we really don't know for sure, though there is some evidence that immunity after COVID is probably not lifelong, and that vaccination, although effective, may not be completely effective against some of the variants. So there will still be a need for using masks, sanitizing, and being sensible.
Right, interesting. Thank you for that response. As I'm for Bulawayo representative, Ms. Jana Ncube, what is your take of the vaccine? And what would you probably encourage the public to think of with regards to the vaccine?
Well, I would say they must do what Dr. Mark has just said.
Mm-hmm.
I think one of the things I'm really proud of with the advice of our health experts, and that is the basis for, I think, a lot of the work that we have done and a lot of the contribution that we have done, because our belief was this is a health crisis, yes, with socio-economic dimensions, but it's primarily a health crisis. So it's the health experts who can advise us the most. But I really think what we are seeing with efforts of bringing in the vaccine into the country, we are aware, is I think already being testified on this during this conversation, that we have batches of vaccines that are now in the country that are being administered across the country, and more are intended to come. I think the aspirations that the government has is that, of course, we see these vaccines. I know there's been conversations as well with private sector to see how we can contribute to ensuring that we are resourcing the acquisition of the vaccine, so that as a population we are, of course, vaccinated. But I think it's going to be a process of time for that to actually happen. And so the encouragement to do what was said by Dr. Dixon, that, you know, let's really making sure we are regularly sanitizing, we're wearing our masks. Honorable Minister spoke so passionately about issues of us adhering to the regulations that have been laid for us, because they are not intended to inhibit us. No parties, no weddings. It's not meant to make your life difficult. It's meant to protect all of us. And so I think that's the message that I really want to emphasize, that we really need as a community to be responsible. My pastor, Dr. Goldishana, taught me that responsible means responding with ability. So we all have to respond with ability and respond effectively, adhere to the lockdown measures. Now, you be home by the 8 p.m. that has been said, so that we are all staying at home and only going out only as necessary. That's the message I think we should be preaching until every Zimbabwean is vaccinated and there's assurance that we are safe.
Sure.
Thank you so much. All right. I'm glad that we have managed to look at where we're coming from and where we are now. So now we'll just want to dive into what the future holds for us. I want to find out from the Honorable Minister with regards to what exactly we hope to achieve, what we hope to keep doing, and what we hope to encourage the public to do in the fight against COVID-19, because the pandemic is not yet over. And like I said earlier on, there are predictions that a third wave might be coming our way come the winter season. So with that as our background, what does the future look like, Honorable Minister? And what do we need to do to ensure that we beat the pandemic?
Thank you, Batabile. I would think, especially when it comes to healthy issues, Mark Dixon can respond well on that one. But on the policy issue and on the policing part of it, we'll continue as government. Try to assist the community whenever there is a need of us advising or sending some messages. Let's continue sending these messages, because some people, they do not believe. Last week, I attended to a funeral when I advised this lady not to try to shake hands with someone. She says, there is nothing wrong with me doing so. If there is anything okuthiwa COVID-19, asikazisivona. To date, we still have such people who are saying so. Hence, I'm saying, let's disseminate the information. Let's continue having these teams disseminating the information to the communities, because if there is a possibility of us getting the third wave, let's quickly move in with the speed to assist the people so that they can understand some of these dangers. Most people, they don't understand. You'll see them by the roadside, you know, some are still arguing to say, if indeed there is a COVID-19, why is it in the Zupco buses, we get into these buses in numbers? So there is nothing of that not. So let's look into it positively. Who can do what in order to avoid the duplication of efforts? We have some NGOs, we have some residents associations, we have some task forces at ward level, at district level. Let's give them all these messages so that we assist each other. Let's assist our health care workers. Let's not just say, bazambone esibhedlela. Let's target our people, especially with the young people. We need the most. Let's engage with them. And also, the government is doing its level best. As Mark was saying, to say we need to have a vaccinated community, because the fact that we're targeting is 60%. Let's put our resources together. Let's put our heads together. How best can we do it in order for us to achieve the set goals, to achieve the set percentage, so in order to protect the community? That's what we are supposed to be doing. And I'm happy, Batabile, you are doing a sterling job. All the stakeholders, I remember very well when we were trying to look into Ekusileni hospital, how best can we revive? Let's refurbish. Everybody was committed, and I'm actually expecting that spirit to continue so that we can actually, at the end, say we have all done it in Bulawayo. We were able to achieve 1, 2, 3 things. That's what I wish we could do as a community.
Okay, thank you so much, Honorable Minister. Before I direct the same question to our doctor present and Ms. Jana Ngube, I have a thread of some comments and some questions from the public. And to allow me to just read through what I have here on my feed, we have Priska Sandvik, who's saying, thank you so much to you all for the efforts in combating COVID-19. I salute you, Siyabonga. And then she further then says, in here in Oslo, we had 2 days ago a case of an elderly lady who tested positive for COVID-19 after being fully vaccinated. She had no symptoms, so one can be vaccinated but carry the disease to others. So I agree, we must continue, as the good doctor says, with masks and washing hands. There you go, Dr. Mark Dixon, is a comment from Priska. So I think we are actually singing the right song. I'm not sure if you would like to respond to that, Dr. Mark Dixon.
Yeah, vaccination is a complicated thing. It's not an on-off switch or a black and white thing where if you're vaccinated 100%, you can't get COVID. What we're looking to achieve with vaccination is to have an immune system that when it's exposed to COVID doesn't get serious COVID or death. And that's what all the vaccines do extremely well. If a third wave comes, which is quite likely in many countries, including Zimbabwe, it will be happening amongst those people who have not been vaccinated. And the lady in Oslo is an example of somebody who she comes into contact with COVID, she tests positive for it, but she doesn't get sick. The people who get sick will be those who have not, for one reason or another, been able to get vaccinated. And that's why it's important for yourself. I feel quite privileged in that I belong to a section of society that could access the vaccine. Let me show you a photo. That's me at Impilo yesterday. Being vaccinated. That's the stuff. I don't really know what to say. Vaccination is extremely safe. I understand there are a lot of messages going around on social media or anything. My only concern about the vaccines that are available is that one or more of them may turn out to be not very effective. I'm quite confident they're all very safe. And all the evidence so far is that those registered approved vaccines are extremely effective, which is why I was delighted to be able to go and get myself vaccinated. What else was I was going to say something else. It's gone out of my head now.
You know, doctor, from your response, really, it just it kicks in that COVID-19 is just something difficult for both the medical practitioners and the general community, because it keeps on mutating, and you may never know how it attacks one, how it's going to affect them. So there's no fixed response really to.
What I was going to say is there's 1 or 2 countries who, for various reasons, were quite well placed and have managed to vaccinate significant sections of their population so far. Israel in particular, Switzerland to some extent, the United Kingdom. And there is already evidence from these countries of how that is protecting society, and the COVID numbers are disappearing. And they, particularly in Israel, have been able to reduce the lockdown. Life is getting back to normal. and so on. So we learned lessons from watching what was happening in the rest of the world, and we acted appropriately last March with our lockdown to prevent a strong first wave. We should learn the vaccination lessons from watching what's happening elsewhere and adopt them and institute them here. So please, if you get the opportunity, go and get the vaccine.
Okay. So with that,
That's a good advice, Vatavile. That's a good advice from a doctor. Really, if one gets a chance, an opportunity, let's get vaccinated.
Okay, well said and emphasized on by the Honorable Minister. So I would like to then probably take us back to our last question that we're just looking at before we close the meeting. I want to understand from you, Honorable, not honorable actually, but from you, Miss Jana Ncube, what the future looks like as someone who's actively involved in the fight against COVID-19. And also I want to find out what are some of the mechanisms or the efforts in place to try and conquer the pandemic? Because the Honorable Minister has given us her perspective and in line with policy making. I want to also find out from I'm for Bulawayo what the future looks like and how we are going to beat the pandemic.
Oh my goodness, if I could answer the last bit, how we're gonna beat the pandemic, I would be a billionaire because the whole world will pay me. But I honestly, all I can do is echo what has been emphasized by the three of us as your panelists, Vatavile. I can't, I think right now, project into a far future. I want to talk about more now in the immediate future. Dr. Dixon has just said it's highly likely that we will see a third wave of the virus. And I think we hear that a lot from the medical community. When you look at what the second wave did in this country, in this city, it was so difficult. December and January were so difficult for most of us because the number of fatalities, people who died and so forth and so on from this virus spiked significantly from what we had seen at the beginning. And what scares me is that I still say our city is not fully ready to fight COVID-19 if it happened to us, is what we saw happen in Europe in March last year, is what we saw happen in New York in June, July I think April, May, June last year. So if that was to happen to Bulawayo, we don't have the bed counts. In a conversation I had with another journalist, I think a week or so ago, Mark, we were talking about your projections that you had generated for us. And she asked me, oh, so did we meet the projections? What is your assessment? I was like, oh my gosh, while we experienced so far the best case scenario, but the numbers are actually lower than the projection numbers are even lower than what the city has experienced. I think what has been good for us as a country and as a city is in the first wave of COVID-19, we didn't have as many fatalities as we saw with the second wave. And so we still don't have the beds that we need in the city. We still don't have the equipment that we need in the city. So I personally want to say the future for all of us as people who love this country, who love this city, is umsebenzi usamkhulu. We really need to still stand up and work together to get our facilities in prim and mint condition, so that should we really experience a surge in cases our hospitals are able to handle it, that we have enough PPE. It breaks my heart when I read newspapers and we are seeing that health workers, the people who are sacrificing their lives to come and take care of our loved ones who are unwell, are contracting COVID in the process. We need to be having our hospitals having adequate PPE and not put their lives at risk. So for me, it's more about the immediate future. The immediate future is me and you putting our pennies together. I really want to challenge the people of Bulawayo, the families of Bulawayo, and I want to challenge my own family. I'm going to get into the WhatsApp group of my family after this. That if as families, if we go together and say, let's buy 5 beds or even 1 bed, and we put a bit of money together and contribute to buy 1 bed, as you know, the Ngube family or the Msimwa family where I married, is if we all did that, we would have enough beds. If we all did that, we would have enough ventilators in the city for those extreme cases. If we did that, we would have you know, the equipment that the hospitals need and the PPE that is required. So I'm not going to speak into the far future. I'm speaking into a more immediate situation because I think we haven't escaped it. June is around the corner, and chances are, if the 3rd wave is coming, our winter season might bring it and exacerbate it.
Okay, great. That is the right way of looking at it, actually, Ms. Jana Ncube, if you ask me, because as much as we are interested in the future, it's also critical that we take it into cognizance the importance of prioritizing the present. So with that being said, I just want to have your parting words from each of you. What would be your parting words as we go our separate ways, for someone who probably just joined in this Zoom meeting and didn't really get to hear some of the amazing contributions you made earlier on? What would be that message that you give to that person? I'd like to start with you, Dr. Mark Dixon.
Thanks. Yes, I think we are all desperate to get back to a normal way of life. And I think we have to accept that if we're going to do that in a meaningful way, then we have to get as many people vaccinated as possible. And we have, in the short, medium term, to continue to take responsibility for both ourselves and those around us by continuing to wear masks and continuing to sanitize and not have large gatherings indoors and the things we know are going to spread this virus.
Okay, thank you so much, Doctor. And you, Ms. Jana Ncube? Over to you, ma'am.
Wash your hands every hour if you can. Put on your mask when you are around people who are not part of your everyday intimate family home setup. When I have visitors come into my house, they stop by the kitchen sink and wash their hands before we do anything. When they're in the house, they put on their masks. Otherwise, we go and sit outside with chairs distanced. In fact, even those few people, and there are very few, have been allowed to come to my house. We are not doing visiting. This is not the season for all of that. I have lost loved ones and friends who have lost loved ones. You know, in our tradition, it's really hard. It's hard not to go and offer condolences because that's not how we're raised. But we are having to resist the edge and find different ways of standing with our loved ones. So right now, you know, if you're not the immediate member of a family that is bereaved, let's find other ways of doing that. So right now for us, I think until, like I said, until we are all vaccinated, let's continue with this gospel for the rest of this year until we say every Zimbabwean has been vaccinated we can fully now go back into society. Otherwise, we are a threat to one another. And yeah, so those would be my lasting words. And maybe last one again, please let's contribute to buy beds and equipment. I am for Bulawayo as both auditors. We are a safe platform. We will account for your money. We will show you the things that your money buys. Let's please contribute so that we can make sure that UPH, Stoneproof, Egusileni have got all the equipment that they need to be able to be ready. One of the things with investing in these facilities is that even post-COVID, then these facilities are there to help take care of all of us and our loved ones and the people.
Okay, thank you so much, Ms. Janangwe. So just to add on to what she said as a parting last words, there's going to be another webinar on Friday that's going to focus mainly on fundraising. And it's just going to give you like a comprehensive a report on the funds that have been donated since March 2020 until present day, how the funds have been distributed to different health institutions, and what lies ahead. So more fundraising is also being called out for. So last but not least, I would like to give this moment to Honorable Minister to give us her parting words. Over to you, ma'am.
I missed the last part. What you have been saying, but because I was disconnected, I don't know what the problem was.
Okay.
What exactly were you talking about? Just so that I respond accordingly.
So, Honorable Minister, what I was saying is, in the event that there is someone who just joined the conversation just now, and they would like to hear from you encouraging words with regards to how to deal with COVID-19, what the future lies ahead, how the future lies ahead, what would you say to them? What would be your parting words?
Let me say, Batabile, thank you so much for that question. Let me say, I would want to advise the people. Recently, we had a family who tested positive. When the response team took them to a quarantine center or an isolation center, some of the boys ran away. And when a follow-up was done, the family members could not say where these young people had gone to. So I would want to advise the family that, the people that if ever we have a family member who has tested positive, let's assist the person. Let's assist ourselves as a family. Let us assist the community, because the person will continue rubbing shoulders or moving up and down, mixing or meeting with other people. It's not good enough. It doesn't augur well. We can actually be spreading this disease because of negligence. I would want to advise our community, Bulawayo enhle, ukuthi once we identify omunye wethu that has been tested positive, ukuthi kathi seek for medication as quickly as possible.
Okay.
City with my healthy workers, cooperate with everyone who matters most, because Bulawayo must be returned to its normal culture, eyokuzwelana, eyokuphathisana, agriculture. We need that. We need to achieve that. And more so, if you look at our informal sector, they're heavily affected. We would want to adhere to the laid down regulations so that they will, once the lockdown is uplifted, they will be able to go back to their working places. Let's assist each other. Our industry as well. We need to grow our industry. We need to assist the vulnerable. If we all fail to adhere to the laid down regulations, i-lockdown izahlala ikhona and will be affected. Let's aim at achieving the best for Bulawayo.
Thank you so much, Honorable Minister. Okay, so there you have it. We need to be collaborative in our efforts to fight against COVID-19. We need to adhere to all precautionary guidelines. And at the end of it all, we'll come out of this pandemic as conquerors. I would like to thank you all, our panelists, for putting aside time to join us on this discussion. It's been a pleasure. It's been great. It's been insightful. And I'd also like to thank the public for following the discussion on Facebook. Your contributions matter, and you can continue contributing even after this live feed is over, because the conversation will continue on the chat section. Like I rightfully said, we have another webinar on Friday. Do make a date and tune in. It's been a pleasure. It's been great. Stay awesome, stay great, and keep safe. Until next time, bye-bye.
Mathabile.
Yes.
Hello.
Hello.
I just wanted to thank all the stakeholders,
Okay.
especially with the I'm for Bulawayo. They have done a good job. Coordination, fundraising, and cooperation that we are getting from industrialists, private sector as a whole, public sector, local authority, and every one of us, Bulawayo. I want to say thank you so much. Let's keep up with the good work. Thank you.
Okay, thank you so much, Mama. Right now, I'm going
Mama.
to say Mama because you spoke to us like a mother who really means well and who's appreciating the efforts that are done by her children, Siyabonga. And I hope I Am for Bulawayo got the word very well, and all the supporting stakeholders. You've done amazing work in the fight against COVID-19. Until next time, you've been great, and I hope to see you on Friday. Bye-bye.